Yeah, hi, good morning. Dr. Dinesh Thakur here again. Last time we discussed about the vaccination strategies for COVID 19. Today, we are about to discuss the most uh, dreaded complication of COVID 19 in these days, which is the black fungus, which you might have heard. Black fungus is basically mucormycosis, which is a rare, invasive, opportunistic fungus. Opportunistic fungus basically means that although it is usually normally present in the body, but it does not cause disease until unless the immune system goes down. And so, most commonly, it is the patients with the lowered immune status who end up facing this dreaded complication of the black fungus. Now, the patients who most commonly suffer from this black fungus are the ones having diabetes mellitus, chronic renal failure, or carcinoma patients, or patients having heart failure whose immunity is compromised. Uh, then there are patients who are on steroids or immunomodulators for like on arthritis and ankylosing spondylitis. So they are the ones who are exposed to this opportunistic fungus. Usually, how it happens is that the patient, once he is discharged from the hospital after having faced the severe symptoms of COVID 19, patients usually come back to the OPD or they call their physician complaining about headache, nasal congestions, swelling around the eye, drooping of eyelids. Usually, the diagnosis is delayed because people keep on waiting that some things might just settle, and usually, when the diagnosis is delayed, there is gravely 50% mortality in such cases. So the most common cause of black fungus uh, in COVID 19 times is steroid overuse and unhygienic oxygen. Steroid overuse, what steroid overuse does is it reduces the immunity. Basically, steroids are given in COVID 19 patients to reduce the hyperactive immune system. So, when you do give patients steroids, it reduces the immunity. And in patients who already have reduced immune system, for example, in diabetes mellitus or CKD or ankylosing spondylitis, uh, steroids act like fuel in fire. So what happens is that when the immunity is reduced to such a drastic extent, all these opportunistic infections like this black fungus or mucormycosis, they start to come up, and they start to grow up in places where they normally reside, but they do not cause any disease. Most common, they grow in sinuses, brain, or lung. The sign and symptom of mucormycosis are some patients do come up with sinus symptoms like sneezing, pain on the cheekbone. Like this is a cheekbone. They start to having pain. They start to have pain on one side of the face on this cheekbone. Some people also have blackening of the cheekbone. Then others have numbness on half portion of the nose. Like this half portion of the nose will be numb. The other will be normal. Then they can come up with toothache, recent loosening of tooth or multiple teeth. Then, when the black fungus is involving the eye, they can come up with blurring of vision. Then they can have eye discharge, which can be either bloody or blackish discharge. Then you can have ear discharge, which can be again bloody or blackish discharge. Then they can have blackening of nose or ear or cheekbones. Then they can have chest pain and shortness of breath and earache. So all these symptoms, although the spectrum of symptoms is pretty big, uh, patients do call back the physician or they present in the OPD with all these symptoms with a history of COVID treatment recently. So once this black fungus is diagnosed, how do you go about treating it? If the black fungus is diagnosed initially, then they can be treated by medical treatment. For example, they are oral as well as intravenous drugs, amphotericin B or posaconazole. These drugs, although they have a very long duration of treatment, but they are known to treat mucormycosis when the disease in the initial stages. But once the disease is in late stages, the only treatment is surgical, which is usually amputation of the diseased part. For example, if the eye is affected, then the eye will have to be removed. If the cheekbone is affected, then the cheekbone has to be removed. If tooth is removed, and so on and so forth. So the morbidity related to all these symptoms due to this disease is huge. So what all can be done is like mostly it happens in diabetes mellitus patients. So the control of sugar is the part of treatment. Like you have to maintain the fasting blood sugar less than 126 grams per deciliter, and then regular checkups have to be advised, and HbA1c should stay less than 6.5. So antibiotics usually have a very limited role in this. Antifungals, as I told you, amphotericin B or oral antifungals can be given. But one thing which is to be remembered here is that amphotericin B is pretty expensive, 3,500 rupees for one dose that has to be given each day for 8 weeks. So that has a huge financial implication as well. So steroids reduce inflammation in the lungs for COVID-19 patients and appear to help stop some of the damage that can happen when the body's immune system has gone into overdrive to fight the COVID infection. But they also reduce immunity and push up the blood sugar levels in diabetic and non-diabetic patients. So the takeaway message from this discussion is that uh, physicians who are treating COVID patients have to use steroids judiciously, and overuse has to be avoided. And people who have recovered from COVID infections need to watch out for symptoms so that this disease, black fungus, can be diagnosed early in its course of development, and the treatment can be started, which is a very simple treatment if it is diagnosed early in the infection. So that was all about black fungus. We'll see you tomorrow again with a very important topic of masking. So till then, thank you.